Hi guys, this is Faraz Ahmed, and today I am going to talk on spinal stenosis. Well, this is a topic that comes in every exam. Rest assured, you'll definitely get a question on spinal stenosis. So you should be spending few minutes to understand it and memorize the stuff which I have given here. Let's talk about it. Well, this is a narrowing of the space within your spine. So if you look at the spine that is coming, this spine get narrowed, and this spine get narrowed because of the herniated disc which has formed. It may be because any tumor is there, or it may be because of outgrowth of the bone that happens from the osteoarthritis, which we call as bony spur. They tend to compress your spine. So what happens that the nerves which are coming out from these foramina, they get compressed because of narrowing of the spine. So what happens that the nerves which are supplying to the distribution, in that distribution you get numbness and you get a pain as well. So what I'm saying here, that it is a bilateral leg pain, you can get a back pain with it as well, and you get a numbness and weakness as well. Now this is worse on walking. Now why it's worsening on the walking is because when you walk, what happens that the spaces between the discs, they come close to each other and they further get narrowed, and you get a further compression of the nerves. But when you are sitting down, or when you are leaning forward, or when you are crouching down, what happens that this compression get relieved, because the spaces between the spine will become widened up. So you release some compression over the nerves. So that's why it is worse on the walking, and it gets relieved when you are sitting down or when you are leaning forward. Clinical examination would be normal in this patient. MRI, we will do the MRI. MRI will tell you the accurate diagnosis of it. How would we treat? Well, we have the analgesia. We give the analgesic for the purpose of the pain. We give antidepressants in terms of amitriptyline for the chronic pain. We give steroids, and we do surgery in laminectomy or lamentomy or lempoplasty. These are the surgeries which will be used. Okay, in this picture you can easily see that this is a herniated disc that has compressed the nerves, and it has narrowed down the spaces between your spine and between your vertebrae as well. In this picture you can see this is a normal disc. There is a normal spinal canal that you are watching, and here these nerves get compressed, which is because of the herniated disc. Okay, this is MRI. This is heavily coming in MRCP part 2 exam. So this image is very important for you. Here in this image you can see that the spine has narrowed down because of the compressions. Okay, this is a picture where I'm telling you my bullets. This is taken from my MRCP bullet book, so you should memorize it. Well, I've written that sitting down will relieve the pain of spinal stenosis, as I mentioned already, but sitting down will aggravate the pain of disc prolapse. When you're sitting down, the pain of the disc prolapse will aggravate. However, both can cause the back pain. Again, in this point, I'm summarizing the spine stenosis, that you got a back pain, leg raise pain aggravated with the leg raise. Sitting relieves the pain, leaning forward relieves the pain. Pain can happen with the extension of the lumbar spine, and the loss of lumbar lordosis. This is the spinal stenosis. Well, other 3 points we should also read, that the most accurate test for myasthenia is a single fiber electromyography. You should know that when you get a moderate size hematoma in your basal ganglion and you do not find any mass effect, your next step would be to admit the patient to stroke unit or put him on observation. Other, I have written about progressive multifocal leukoencephalopathy, that you either get a cancer patient, or either you get a patient who is chronic immunodeficient, or he is on the immunosuppressive drugs and he develops some personality changes, intellectual impairment, there's some focality as well, and you get some cortical blindness, seizures, coma, and CSF. The CSF is normal. MRI shows that there are the white matter lesions, and you know that this is caused by the JC virus. This is a progressive multifocal leukoencephalopathy. Thank you for watching. Please subscribe my channel for more videos.